Hey, so today we're going to talk about tendon pain. A lot of people get tendon pain throughout their lives, and it can be one of those debilitating type injuries. When we think about tendons, we want to talk about load. Now, tendons are a unique structure in our body. See, when typically we get injured, people always want to say, let's rest, because the rest is giving time for the tissues that have been injured, time to heal. And in reality, with tendons, the thing we want to think about is we actually need to load them. Tendons need load in order to function appropriately. Now, when we do injure a tendon, there's all sorts of different theories about why tendon pain occurs. We used to think that it's tendinitis, where it's an inflammatory reaction. And what we find in the literature is that actually it's not so much inflammatory. We don't really see too many inflammatory markers. Or like maybe we typically would see in some sort of an acute injury where there's this big rush of healing proteins and different things that are going to rush to the scene to try to bring up the inflammation, allow our body to heal itself. But when we have these chronic tendon injuries, we don't necessarily see that. The other thought is that, well, maybe it's an injury when we've ripped our collagen or we've stretched our collagen. And a lot of times we actually don't really see that either. We see damage to the collagen or disorganization to it in a small portion of the tendon itself. We don't see like tearing of a piece of paper or we think of like a muscle tear or anything like that. It's a little bit different than that. Even though we oftentimes think they equate, it's not so much. What we tend to find is this kind of disorganization that I mentioned of our collagen fibrils. And collagen is the type of elastic tissue we have that are found in our joints, our ligaments. They are the tissue. It's found throughout our body. It's the tissue that is stretchy and that provides some structure but allows a little bit of function, and oftentimes is not very well vascularized, meaning that when it's injured, it doesn't heal very well. And then again, this is where we find our tendons to lay. Once they get injured, which happens usually due to some sort of acute trauma, an attempt where maybe our loads that we place on the tendon itself, the tendon just isn't ready for those loads, and we get a little bit of damage. Now, the good news and the bad news: damage to the tendon doesn't actually equate to pain. So if you have damage, that doesn't necessarily mean that that's where your pain's coming from in regards to this. But on that same level, once we do have damage, we realize that we really can't change the structure of it. We can't get that better due to the lack of vascularization in the tendon. So what do? So if we have a tendon injury, the things that we focus on the most are what we call treating the donut, not the hole. So if our tendon is a simple round circle, and we get a damaged area, so think of now we're looking at a donut, circle, and then a small circle in the middle, and that small circle is the damaged area. We don't want to focus on that. We want to focus on strengthening everything around the hole, focusing on the donut. We want to pay attention to strengthening this tissue and keeping this part of the tendon healthy and strong and resilient so that it can compensate for all the injured area that it has. And we find that when we do this, we get better results, we get improved function, which is always what we're going for, and when we improve function, we ultimately decrease pain. So the key to tendinopathies are when we have them, we want to load them in a progressive fashion. And I'll leave a link at the bottom of this YouTube video so that you can see where to go, where to find the right information for progressive loading. Most of the information that I'm using today is from a lecture from Jill Cook. She is an esteemed professor and a vital source of information for tendon pathology. And if you want to learn more, please feel free to drop a comment or come and check out our website at swchealthcenter.com and follow us on Instagram for more tendinopathy exercises, progressions, and ways to manage your symptoms if you're having them right now.